conference. In 2019, the world faced the COVID-19 pandemic, which covered 199 countries and territories, and was represented in different severity, from mild, most of the patients, to severe and critical symptoms. But COVID-19 was not a simple viral respiratory infection and turned out a polysystemic inflammatory disease, and endothelial dysfunction was detected as one of the pathological processes induced by SARS-CoV-2 infection. However, even after recovering, the most of people continue suffering from different symptoms, which can't be explained by other reasons. The World Health Organization offered to call this condition as post-COVID syndrome and included it in the international classification of the diseases. Like COVID-19, the post-COVID syndrome is represented by the disturbances from different systems and organs. You see that patient can have complaints, neurological, pulmonary, cutaneous, psychiatric, cardiovascular, and general type. So the most prevalent symptoms are represented here. So on the first place, it's a fatigue, dyspnea, arthromyalgia, depression, anxiety, memory loss, concentration difficulties, and insomnia. But the reason of post-COVID condition remained unclear, and there were not unified approaches to the treatment of this group of patients. Though it was reasonable to think that microcirculation disturbances was involved as well. Since 2013, in the Center of Reputable Ophthalmology, we've been researching microcirculation disturbances in patients with degenerative diseases of retina and optic nerve, in cooperation with different specialists except ophthalmologists. And for this purpose, we've been using computer capillary scope OCO for bulbar conjunctive angioscopy. It's our own invention. And this complex provides non-contact video registration of blood flow and conjunctive vessels, magnification 200 times. The duration of the study is 15 seconds, and it provides possibility to create the database of digital video and photo images. So some words about advantages of bulbar conjunctive angioscopy. Now, later I'll call it BCA, abbreviation BCA, because BCA is a window to microcirculation in our opinion. As I told, it's a non-invasive method of microcirculation investigation, and conjunctival microvessels are located superficially, so it allows to visualize all parts of microcirculation network. This is arterioles, venules, and capillaries. And so we can see blood flow inside and even to estimate Sludge syndrome. So this is an intravascular erythrocytes aggregation. And conjunctiva is moisturized with tear fluid and protected with eyelids from influence of external factor. And so which parameters we investigate with BCA? This is a diameter of arterioles and venules, blood flow velocity in arterioles and venules, presence of sludge phenomenon, as I told, and even erythrocyte stasis, AV shunts, so the shunts between arterioles and venules, morphology of capillaries, the density of the capillary network on the limbus. To give you some explanation and demonstrate some areas where we perform our investigation, I'd like to remind you a little bit the scheme on the screen, which you see, how we move from the center to the external angle of their eye. So in the center, you see this is a pupil, then cornea, and then conjunctiva. This is an object of our investigation. So the first area which we investigate, this is a corneal limbus with around 2 millimeter, where we can find capillaries. The second area which we can see, this is a perilimbus with 4 millimeter, where we can see precapillaries. The next one, it's a zone of anastomosis between branches of different size of internal and external carotids, and moving outside or from the pupil, so we can see the area of afferent vessels, where we can investigate the pair and find the pair of venous and arterials. The next pictures, I think, explain and demonstrate what kind of images we can get performing BCA. So here you can see the picture of the limbus. On the left, this is a normal limbus where you can see capillaries, and on the right, you see the limbus of the patient for sure who has microvasculation disturbances, because we can't see capillaries, and we call vascular-free zones of limbus. The next one, you see the zone of perilimbus, and here we can see the AV anastomosis and vessels which go parallel to limbus. And usually we can see these changes in patients with microcirculation disturbances, and they characterize the compensatory mechanism if patient has microcirculation disturbances. Here you can see the sludge syndrome. Yes, so this is how the blood flow inside vessels, and you see that some spaces between inside the blood flow, and we can say this is a sludge syndrome. And on the right picture, you can see the irregularity of venous diameter, and sludge syndrome as well. On this picture, you see the zone of afferent vessels. So we try to find the pair of arterioles and venous to investigate the blood flow velocity inside them, to estimate diameter of arterioles and venous, to calculate the arterial-venous ratio, that's it. And of course, we used BCA for evaluation of the treatment effect. On the left, you can see that there was sludge syndrome inside the blood vessels of the patient. And after the treatment, we didn't watch sludge syndrome at all. So first of all, we used BCA for diagnosis of microcirculation disturbances and for evaluation of the treatment effect in our patient. In 2021-2022, we followed up some patients with post-COVID syndrome or who recovered after COVID-19 even without post-COVID syndrome. And we found out a very interesting thing that venous of this patient had a specific form of deformation. We call it corkscrew-shaped crimpiness of venous. Yes, you see that it's absolutely clear to see this shape on this picture. So our hypothesis was that in patient who recovered after COVID-19 and who had post-COVID syndrome, these findings made us guess that these changes are consequences of endothelial dysfunction. And if we use drugs which can improve endothelial dysfunction, we can help patients to cope with post-COVID syndrome. So now let me represent the clinical case for demonstration. So we followed up a 23 years old woman, a medical student, who since September 2021 worked as a nurse in the hospital for patients with COVID-19. During 3 weeks in October, she felt badly. She had fever, severe weakness, and her sense of smell disappeared. But she continued working and even studying in the university online. In 3 weeks, her blood tests were taken, and they were found that she had antibodies, immunoglobulin G, to SARS-CoV-2. So such combination of specific clinical changes, contacts with people who were sick with COVID-19 and presence of antibody let us think that this young lady was sick with COVID-19 mild form. But you see that during November, December, January, up to February, she had other complaints as weakness. It was not so severe, but it disturbed her a lot. Her blood temperature was normal, and she noticed hair loss. She had eyesight problems, brain fog, memory problems, and headache. And so with such complaints, she reached our center. But during the investigation, ophthalmologists and general practitioner didn't find any changes in her condition, but neurologists diagnosed a light depressive episode and anxiety condition. So the conclusion of the specialist was that our patient had post-COVID syndrome. And to improve our hypothesis that post-COVID syndrome can be explained by the microcirculation disturbances induced by a new coronavirus infection, we thought that treatment with drugs which can improve microcirculation and diminish tissues hypoxia can improve our patient's condition. So for the treatment, we used 3 drugs which are improved in our country, in the Russian Federation, for usage. And these drugs had anti-hypoxic effect, antioxidant effect, as well as a disintoxication and organoprotective effects. Totally, the course of treatment continued 3 weeks. During first 10 days, we use drugs intravenously, and later in intramuscular injection and peros. And as well, I forgot to tell that, of course, we investigated her microcirculation using BCA, and I'll show you the results a little bit later. So when we re-estimated her condition in 3 weeks and even after 7 months after primary investigation, we found out that her symptoms were decreasing, diminishing, and in 7 months, she felt absolutely healthy. And in 7 months, regarding the Hamilton rating scale for depression and Hamilton anxiety rating scale, she didn't have any depression and anxiety. If we speak about the dynamic of blood velocity in arterioles and venous on the bulbar conjunctiva before and after treatment, we saw that blood velocity significantly increased in arterioles as well as in venous, and in 7 months it became stable. As well, if we speak about the qualitative parameters of bulbar conjunctival microcirculation before and after treatment, also we didn't find sludge phenomenon, and number of vascular zones on the limbus decreased as well, but the curl of the venous remain, but the number of vessels where we can watch a corkscrew curl diminished as well. So on this picture, you can see the bulbar conjunctival angioscopy before treatment and after treatment. Here you see the pathological corkscrew deformation of venous and sludge syndrome in the vessels before treatment. After treatment, we didn't watch sludge syndrome, and we saw the reduction, the number of vessels which were deformed as corkscrew. Here we can see the images of the limbus, and moving from left to the right from the pictures before treatment and in 7 months, we can see that the density of capillary network increased. And of course, it said about the improvement of microcirculation. In summary, we faced with the case of post-COVID syndrome in young female after mild form of COVID-19. Main manifestations were represented mostly with mental and cognitive status and olfactory dysfunction. Microcirculation disturbances were detected with BCA. Corkscrew-shaped crimpiness of venous was found, and treatment with antioxidant and antihypoxant improved patients' condition and parameters of BCA. So our results corresponded to the results which other authors got. So they indicated that after mild COVID-19, around from 10 to 35% of the patients had post-COVID syndrome. Fatigue, cognitive impairment, and olfactory dysfunction, headache were on their first place in such type of patients. And as a conclusion, COVID-19 highlighted the necessity of microcirculation assessment. BCA is the key for understanding the role of microcirculation in pathogenesis of COVID-19. BCA can be used in assessing the severity of post-COVID complications and for possible response to treatment. And treatment with antihypoxant and antioxidant improve clinical condition through improvement of microcirculation parameters. Thank you for attention. That's it.
Thank you so much for your presentation.